Every time you climb a stair, one nerve makes your knees straighten enough to take your weight. Today, we are moving into the lower limb to decode the femoral nerve. Hello everyone, I'm Dr. Divya Desa and welcome back to ACE Anatomy, where anatomy becomes simple, visual and unforgettable. In today's video, we are diving deep into the anatomy of femoral nerve, the largest branch of the lumbar plexus. We will explore its origin, course, relations, branches and the areas of supply. So if you are ready to ace your anatomy, let's get started. The femoral nerve is the largest branch of the lumbar plexus. It arises from the posterior divisions of the L2 to L4, that is L2, L3 and L4 ventral rami. And the root value of femoral nerve is L2, L3 and L4. Now the lumbar plexus are formed from the anterior or ventral rami of L1, L2, L3 and L4 lumbar nerves. And the femoral nerve, it arises from the posterior divisions of the ventral rami of L2, L3 and L4 lumbar nerves. Let's look at the course of the femoral nerve in the abdomen after it arises from the lumbar plexus. The femoral nerve arises within the psoas major muscle from the lumbar plexus, that is from the posterior divisions of ventral rami of L2, L3 and L4. So once it begins here, it descends through the substance of the psoas major and emerges from its lateral border and passes between the psoas and the iliacus muscle. And then it enters the thigh by passing behind the inguinal ligament lateral to the femoral sheath. The abdomen, it gives two motor branches, that is one to the iliacus and other one to the pectineus muscle before it enters the thigh. The nerve is the nerve of the anterior compartment of the thigh. So now let's look at the course of the femoral nerve in the thigh. Femoral nerve enters the thigh by passing behind the inguinal ligament and lies lateral to the femoral sheath. And in the thigh, it lies in a triangle here where we call it as the femoral triangle. Now here you need to remember that the femoral nerve, it lies outside the femoral sheath. It doesn't lie within the femoral sheath but outside and lateral to the sheath. Now why does it lie outside? Because the femoral nerve is formed in the abdomen, deeper in the abdomen, in the posterior abdominal wall from the lumbar plexus. So that is why during its course it is outside the sheath. Now in the femoral triangle in the thigh, the femoral nerve, it lies lateral to the femoral sheath and it runs for about 2.5 cm below the inguinal ligament, and it will divide into anterior and posterior divisions, and both these divisions will be straddling or it will be enclosing the lateral circumflex femoral artery. The femoral nerve, once it enters the thigh behind the inguinal ligament, runs for about 2.5 centimeters and divides into its anterior division and posterior division, and both these divisions, they will enclose this lateral circumflex femoral artery. So this anterior division is mainly cutaneous, whereas the posterior division is mainly motor. Now let's look at the branches of the anterior and posterior divisions of the femoral nerve. The anterior division is mainly cutaneous. So it gives two cutaneous nerves, medial cutaneous and intermediate cutaneous nerves, and these nerves supplies the skin over the anterior and medial aspect of the thigh. The only muscular branch it gives is to the sartorius. So the sartorius muscle is supplied by the anterior division of the femoral nerve. Whereas the posterior division, it supplies the quadriceps femoris muscle, which includes rectus femoris, vastus lateralis, vastus medialis, vastus intermedius, as well as the articularis genu. It also gives two articular branches to the hip joint as well as to the knee joint. and then it continues as the cutaneous nerve, which we call it as the saphenous nerve. So thus the posterior division is mainly motor. So to remember, you need to remember that the sartorius is the only muscle supplied by the anterior division, and the posterior division is mainly motor, and then it continues as saphenous nerve after supplying the extensors of the thigh. In the leg, the posterior division continues as the saphenous nerve, and it is mainly cutaneous in supply. The saphenous nerve in the leg pierces the deep fascia on the medial side of the knee between the sartorius and gracilis and runs downwards in front of the great saphenous vein. So here it gives an infrapatellar branch which curves downward and forward to supply the skin over the ligamentum patella. So this saphenous nerve, it basically supplies the skin on the medial side of the leg. Thus the saphenous nerve gives one cutaneous branch, that is the infrapatellar branch, to supply the skin over the ligamentum patella, as well as cutaneous nerves to supply the skin on the medial side of the leg. In the foot, the saphenous nerve is cutaneous in supply. Supplies the skin on the medial side of the foot up to the ball of the great toe. Now let's summarize the femoral nerve. So the femoral nerve is the largest branch of the lumbar plexus, having the root value of L2, L3 and L4. It arises within the psoas major muscle from the posterior divisions of the ventral rami of L2, L3 and L4. So it descends through the substance of the psoas major muscle, emerges along its lateral border, passes between the psoas and the iliacus to enter the thigh just below the inguinal ligament lateral to the femoral sheath. And about 2 centimeters distal to the inguinal ligament, it divides into its anterior and posterior divisions. And these two divisions, they straddle the lateral circumflex femoral artery. So coming to the branches, before it enters the thigh, it gives branches, two motor branches to the iliacus and to the pectineus muscle. In the thigh, its anterior division is mainly cutaneous, giving the medial cutaneous nerve of thigh and intermediate cutaneous nerve of thigh. These two nerves supply the skin over the anterior and medial aspect of the thigh. The only muscular branch given by the anterior division is to the sartorius. The posterior division is mainly motor and supplies the quadriceps femoris muscle, which includes rectus femoris, vastus lateralis, vastus intermedialis and vastus medialis. It also gives articular branches to the hip as well as to the knee joint. This posterior division in the leg continues as cutaneous nerve, that is the saphenous nerve, which supplies the skin on the medial side of the leg as well as on the medial side of the foot up to the ball of the great toe. So this was about the branches of femoral nerve. And in the next video, we will be discussing about the clinical aspects of femoral nerve. And that's a wrap for today's episode of Decode Anatomy. Thank you for joining me on ACE Anatomy. If this video added value to your learning, please like, share, subscribe and hit the bell icon so you will never miss an update. Until next time, keep learning with purpose and let's educate, empower and excel.